Earlier this week, Honolulu Mayor Rick Blangiardi announced he was limiting large indoor gatherings to 50% capacity to slow the spread of COVID-19.
Among those speaking at the news conference was Dr. Mark Mugiishi, the president and CEO of HMSA, which has more than 700,000 members. Doctor, thank you so much for joining us tonight. Now, when I listened to you at the news conference, I thought you really came across as a voice of reason. And one of your main points was that to control this pandemic, being vaccinated has got to become routine and not political.
Absolutely. We have probably one of the greatest medical scientific innovations in a generation with the mRNA vaccines that have come out. They afford an incredible amount of protection for people. First, they make it harder for you to get the disease. And then if you happen to get it, it really mitigates the severity. So it protects you, it helps protect your families, it helps protect your friends, and then ultimately it helps protect all of society. So I think it really behooves all of us to get vaccinated, and now, as we're learning with the Omicron, to get boosted as well.
And you were also a voice of optimism because you were saying, despite us moving into the third year of this pandemic, historically this is also the year that it becomes endemic, right? So that means we learn to live with it. So can you explain those reasons why?
Yeah, I think, if you look throughout history, there's been a lot of what we call respiratory pandemics. So things like certain types of flus and different viruses that travel through the air and attack your airways. Those typically turn from pandemic to endemic in about 3 years. And I think the main reason why that happens is three things happen. First, the virus will change. So it will mutate and become like the Omicron, where it's much more contagious but less severe. So more and more people catch it but survive. And so your immune system remembers it. The virus is no longer what we call novel. So your immune system has a basis by which it builds up the ability to fight it. So that's one thing. The second thing is medical science is going to advance. And that's what we see here with our vaccines, with our new rapid tests, with our pharmaceuticals that help make it less severe when you get the disease. And the final thing is that people learn to live with it, right? They learn to adapt. And the vaccines are one way, making sure that that happens, making sure that common sense becomes common. So, this is an infectious disease. So one of the things I always tell everybody is infectious diseases are infectious. That's why they're called that. So having common sense means things like, if you're sick, stay away from other people. If you are in a high-risk situation, wear a mask and protect yourself and others. If it's peak season, stay away from high-risk situations. Use good hygiene. Those things should become common. And last but not least, have the decency and the common sense and the wisdom to protect yourself when you have tools at your disposal. So whatever things we got, let's use them. And all of those things together are going to help us get through that, hopefully this year, the third year.
As you mentioned, Doctor, the Omicron variant seems to be more transmissible, but has less severe symptoms. How much relief should we take from that, though?
Well, it's still, something that you have to be careful about. Part of the reason why the symptoms are less severe is that it tends to attack the upper airways rather than the lungs. So COVID was so damaging in its original form because it would settle in the lungs, cause bad pneumonia, and make people need ventilators and oxygen and other things like that. This can still do that, just not as much. It tends to stay in the upper airways and act more like the cold or the flu. But still, many, many more people are getting it because it's contagious. So just make up a number. Let's say, 5 times more people, you're 5 times less likely to get a severe infection than the previous one. But if 5 times more people get infected, you're going to get the same number of people who have a severe illness. So that's why it's still wise to try and take care of yourself and make sure you protect yourself from high-risk situations, but more importantly, you get vaccinated and boosted.
In your opinion, when do you think hospitals will start to see a surge peaking out? Is it coming this month, or when do you think we'll see that?
There's a lot of different guesses, prognostications, actually, and most of them are based on data, so they're reasonable guesses, but they rely on a lot of assumptions. So if you look at most of the ones that have been created in Hawaii, most of the models, they suggest that the peak will be somewhere toward the ending of January. And then, then both the number of cases and hospitalizations might start coming down. If you look at what's happened elsewhere, in many places it's faster than that, right? That somewhere maybe in another couple of weeks, like maybe the third week of January, we'd see the peak and start coming down. So it's hard to know, but I think we have some degree of control over that because the more people get vaccinated, the more people get boosted, and the more people who just protect themselves and their families by not doing a lot of risky things, the faster maybe we'll come to the other side of that big crest.
I'm going to assume that you've worked with Mayor Blangiardi on policy. Do you expect any more restrictions to be reinstated anytime soon?
I mean, I hope not. And I think the mayor hopes not as well, right? For a couple of reasons. One is that, we're hoping that people will heed all of the personal responsibility calls that he's asking for, and that we actually will get control of this. The other point is that, we've talked about how contagious this is. Restrictions, if absolutely necessary, need to happen, but they're not going to be as effective as restrictions were before because of how contagious this is. So, I'll just give you an example. In the past, we used to say 25 people shouldn't get together, and then sometimes it was no more than 10, and then there was a time when, 5 people should be at a table max, right? Well, with this Omicron, it's so contagious. If you have 5 people at a table, the 5 people are going to get infected if one of them is infected. If you have 10, the 10 will. And, so you're restricting the number is not going to necessarily change that much the degree of the degree of cases that are coming up. It will have some impact. So if we have to do it, we have to do it. But it's just not the best tool. So hoping that that's not the tool we'll have to use. So I don't think the mayor has any plans, but obviously, as he said himself, if things get really out of hand, then he's going to use whatever tools he has to keep the county safe.
Okay, thank you so much, Doctor. We appreciate your time. Hopefully we can ride out the surge and better times are not too far away.
Yeah, mahalo for having me, and thanks. I think we're going to rely on the media to kind of spread the same word, because when people adapt, we'll get control of this thing.
Okay, Dr. Mark Mugiishi,